This is our final project, Anatomy of the Rowing Motion, Trunk Rotation at the Catch by Reagan, Cole, Kristen, and Rebecca. Sweep rowing is a type of rowing in which an athlete holds one oar with both hands. The stroke in rowing is a repetitive motion that is divided into two phases, the recovery and the drive. The beginning of the drive initially starts with the catch, a position in which a rower's arms are extended, their trunk is rotated to the side of their oar, and their knees and hips are flexed. The shoulders are then lifted slightly as the blade is placed in the water. At this position, the drive is initiated when the force is applied against the footboard, extending the leg while the hips remain flexed and the arms remain extended. The trunk opens up next as the hips extend, making sure the arms still remain extended at this position. The last part of the drive requires flexing the elbows to pull the handle of the oar towards your trunk, aiming for around your xiphoid process of your sternum. At this position, called the finish, the hands tap the blade out of the water and begin recovery of the stroke. In the reverse order of the drive, the arms are extended first, the hips are then flexed, and the knees rise up to the chest as they are fully flexed. The rower is once again at the catch of the stroke as their trunk rotates towards their inside arm or the side of their oar. For our project, we are going to be mainly looking at the anatomy of the trunk and the upper extremity muscles during the front half of the stroke, the catch, and the initial drive. In the sport of rowing, athletes are required to compete in the boats on the water, while many train indoors on rowing machines called ergs. The major difference between sweep rowing and erging is the position of the trunk at the catch. When an athlete is holding an oar, they rotate their trunk towards their inside arm as they are moving up to the catch, as demonstrated by Rebecca in the video. However, when a rower is erging, the handle is directly in front of the athlete, so the trunk rotation does not occur. As you can see in this video, Rebecca completes the same sequence of the stroke as when she is rowing in the boat, but the trunk does not rotate at the catch.
At the catch, as explained earlier, the arms are fully extended, the trunk is flexed and rotated, and the shoulder is in rotation with a slight downward angle parallel to the oar. In this position, before the drive sequence begins, the posterior muscles involved are the deltoids, triceps, trapezius, rhomboid major and minor, and erector spinae, while the anterior muscles, serratus anterior, internal obliques, external obliques, transverse abdominis, and rectus abdominis are also engaged. However, the inside arm and outside arm have slightly different muscle actions. For the outside arm, the anterior fibers of the deltoids perform flexion of the glenohumeral joint with some medial rotation, while the triceps aid in the extension of the elbow, which is important for a strong straight arm position at the catch and during the initial drive. The trapezius for both arms will elevate the scapula using the superior fibers with superior rotation as well. The rhomboids also assist in the elevation of the scapula. The serratus anterior muscle aids in the superior rotation, protraction, and stabilization of the scapula at the catch. However, it is more active on the outside arm than inside, as the scapula and shoulder is put into an unstable position away and across the body. As well as, when force from the drive is applied, there is a need for increased stabilization to prevent muscle tearing and provide the connection between the water and the oar/body at the scapula. The erector spinae is made up of ilicostalis, longissimus, and spinalis, in order from proximal to distal of the spine. These muscles provide resistance that assists in controlling the action of bending forward, or in this case, trunk flexion in a seated position. They are also important for returning the back to the erect position, which begins halfway through the drive. The ilicostalis is important for lateral flexion of the trunk, and specifically in the rowing stroke, this occurs on the inside portion of the body, helping with bending the vertebral column to the same side, allowing the shoulder position at the catch to become parallel to the oar. The longissimus thoracis muscle allows for rotation to the same side, known as ipsilateral rotation. The rectus abdominis pulls the ribs downward and pelvis inward, helping with the slight curvature of the back and stable posture at the catch to receive an increased force. Trunk flexion occurs when both sides of the external obliques, rectus abdominis, and internal oblique muscles are contracted. Lateral flexion, when the inside shoulder seems to drop, is unilateral contraction of external obliques on the right side in partnership with the internal oblique contraction on the right side as well. During the trunk rotation at the catch, the internal oblique provides ipsilateral rotation to the inside portion of the body, which would be Rebecca's right side, while the external oblique provides contralateral rotation of the outside portion of the trunk, which would be Rebecca's left side. At the initial drive, there is a huge leg emphasis. However, the upper extremities are connecting the lower body to the oar handle. The initial drive sequence puts a large part of the load and suspension on the upper extremity, particularly the latissimus dorsi muscle, to create this connection. During the initial drive, the latissimus dorsi muscle bears the load and is responsible for adducting the glenohumeral joint and bringing the shoulder in and down, causing a suspension of weight and force off of the handle. The supraspinatus, infraspinatus, subscapularis, teres minor, serratus anterior, and trapezius muscles during the drive sequence are all contracting as stabilizers of the scapula, as well as the teres major is helping adduct and extend the humeral joint.
Competitive rowing is very strenuous on the body and can cause many injuries, even when done correctly. While doing the rowing motion, it is common for the external obliques to exert opposing forces on the ribs. This opposing force causes extra stresses on the ribs, which can cause stress fractures on the ribs. Another way stress fractures of the ribs may occur is that there are four powerful eccentric abdominal flexors that rotate the spine and cause compressive forces on the ribs. These muscles are the external obliques, internal obliques, rectus abdominis, and transversus abdominis. Rib stress fractures are more common in women than men, and the rate of occurrence is between 6.1% and 22.6% in rowers. That was from a study done by Rumble et al. In 2012. Lumbar injuries are also common for people who row, as 32% of collegiate rowers develop back pain during their collegiate career, in a study that was found in a study done by Davis and Finoff in 2003. The back pain during rowing is often caused by the rotation of the lower back during the catch. These back injuries can be nonspecific.
There are many methods for rehabilitating and preventing injuries that often occur in rowing. With any activity, it is extremely important to perform the movement with a correct form that maximizes movement efficiency and force production, which in turn reduces the risk of injury and boosts performance. Many injuries that are prevalent in rowing are chronic or stress injuries due to the repetitive nature of the sport. To help prevent against these types of injuries in general, it is important to know when to rest and to have enough recovery time for the body to heal. Low back pain is a little challenging to prevent in rowers because of the repetitive twisting and pulling motions while leaning forward. Some injury prevention methods for low back pain include strengthening of core musculature, glutes and hamstrings, training on both sides to prevent muscle imbalances, and making sure not to overtrain or train too long. As rowers fatigue, form starts to get worse, so making sure that they are not overworking is important. If a rower is not competing due to back pain, rehab would entail many of the things that I just said, along with rest until the pain gets better. Treatment for rib stress fractures is rest for 4 to 6 weeks. During this time, the athlete can do any activity he or she pleases as long as it doesn't hurt them to do so. Once the pain goes away, the rower can return to training and competition. It is important to make sure that their form has not been compensated in any way, and it is recommended that they incorporate core stabilization and core strengthening training into their regimen. To summarize, we described the function of the upper extremity muscles at the catch. We described the function of the thoracic and lumbar muscles for body stabilization and connection from handle to water. Then we just talked about the upper extremity and trunk anatomy's contribution to rib stress fractures and lumbar injuries. Lastly, we talked about some rehab and injury prevention methods for a few common rowing injuries. Hopefully you've learned something from this video, and some of these takeaways will stick with you.
Rotate, catch. Arms away, body's over. Rotate, and catch. Arms away, body's over.